Hey guys, happy Monday. Want to hop on really quickly and talk about a couple things. So first, it is National Diabetes Month, and interestingly enough, I saw a patient today who was 22 years old with diabetes. And you know, we discussed like that's really young to have diabetes, and she mentioned that it runs in her family, um, which that is a risk factor for diabetes. But even with a family history, unless it's type 1, like crazy. So we talked about diet, talked about exercise, things that she can do to improve and maybe not get rid of the diabetes, but maybe lower her need for medications or different things like that. So when it comes to diabetes, family history is definitely important, but also consider things like that you can control, like do you drink soda? So when we talked about that, did she drink soda? She said no, like usually just juice. But when it comes to diabetes, juice is as bad as, if not worse than, um, soda. So sweet tea, that's awful. Other things you want to try to do if you have been diagnosed with or at risk for diabetes is really work on your carb intake. So that's bread, rice, pasta. So a lot of people will cut back on those things when they're trying to lose weight. But even if you're not trying to lose weight, if you have a family history of diabetes, it would be really good to just limit your intake of bread, rice, and pasta. Other things to look out for in general, in terms of diabetes risk, is your waist circumference. So a lot of people go to the doctor, you get your blood pressure checked, get your weight checked, all of those things, but you should also be getting your waist circumference checked. Waist circumference over 30 for females, I believe over 35 for males. I'll have to double check on that. Um, and if that's the case, then work on not just weight loss, but losing the fat around your abdomen, because more fat around your abdomen actually increases your risk for diabetes. A lot of people have that like black patch on their neck. That is not just your neck is dirty and you need to scrub it more. That's acanthosis nigrans, and it is a sign that you are potentially at risk for diabetes. I'm just doing this off the top of my head, no notes or anything. So just kind of thinking about the things that I see and people at risk for diabetes, because it is National Diabetes Awareness Month. If you want more information on diabetes, definitely consider going to the American Diabetes Association website. They usually have a walk in each major city. That's a way to get involved, get more information, learn about screening in your community. You don't have to be a doctor to be a health ambassador in your community. You can invite out med students or pharmacy students or local doctors to come and do blood sugar checks. Um, he said, "How do you like that sandwich, though? For real, for real." So I think he's referring to the Popeye sandwich. I have not had the Popeye sandwich yet. Every time I think about doing it, I'm like, do I want to do it? I'm down about 3 pounds, so I really would have to hit like a major weight loss milestone to treat myself with that Popeye sandwich, and I am not there yet. So for now, I'll just have to imagine how good and moist and amazing it is. But I'm not eating that for now. Diabetes. Important numbers to know if you are at risk for diabetes or have a family history of diabetes. Your hemoglobin A1C. It's not enough to just check your finger and say, oh, well, my blood sugar wasn't high right now at this moment in time. If your blood sugar has been, it could be high the night before, but have dipped down based on your insulin, right? Because that's what insulin does for your body. It regulates your blood sugar. So I like the hemoglobin A1C, which is a number that helps us tell over time how your blood sugar has been. Now, a normal hemoglobin A1C is less than 6.5, but that doesn't actually measure your blood sugar, right? Because your blood sugar should never be 6.5. It tells us that if it's 6.5, and I'm just making up the numbers because I don't know what exactly it correlates to, but that means your blood sugar is probably normally between like 100 and 120, for example, versus if it's 7, maybe that means 150 to 200, something like that. But in general, once you start having blood sugars in the 200s, or your hemoglobin A1C is 6.5 and above, then you have some concerns where you really need to work on the diet and exercise. I know a fear for a lot of people is insulin, right? Like, they're not really afraid of diabetes. Some people just see it as like, my family has it, I'm going to have it. But they are afraid of insulin. So usually I start insulin with my patients if their A1C is 10 or above. Everyone may have their different thresholds, and that's also the point at which I send my patients to get a consultation with a endocrinologist as well. But everybody's, there are recommendations, guidelines, but the way each doctor practices may be a little bit different. So if you have diabetes and you want to stay off insulin, then you should be motivated to keep your A1C down so that doesn't happen. That's not the case, that you won't have to end up on diabetes medications. If you have a loved one or family member who has diabetes, please make sure they're going to the dentist. Please make sure if they're, I would say probably over 40, that they've had like an EKG. Please make sure that they have seen a podiatrist, because a lot of people with diabetes lose sensation in their feet, so they can have like serious things going on with their feet and have no idea. And make sure they're getting their eyes checked. I believe diabetes is still the #1 cause of blindness worldwide. So if you're just tuning in, I just gave some of my recommendations for avoiding diabetes, living with diabetes, and being an advocate for your community in terms of diabetes. So if you have any questions, DM me. I'll be happy to point you in the right direction. I only practice in Texas, but 9 times out of 10, I know a doctor anywhere. So thanks for tuning in. A couple other things this month. Let's see. It is also, Lung Cancer Awareness Month. So maybe I'll talk about lung cancer and smoking. Epilepsy Awareness Month. Maybe I'll bring on one of my amazing neurologist friends and interview them. And it is also National Impotency Month. You don't want me to talk about that? I don't mind. And National Alzheimer's Disease Month. So lots of things to talk about. So next Monday, I'll try to go live, talk about another health topic. May do it even sooner, but I'll say Monday for sure. I also want to say, if you haven't looked at my story today, look at my story. There's a very interesting case right now in Texas, a gentleman by the name of Rodney Reed, who is about to be executed for the murder of a woman back in the 1990s. And from what I've read, it seems, that there's a very good chance this man is innocent. So we have an opportunity to potentially help save a man's life, because politicians, specifically Governor Greg Abbott does have the power to stop his execution. So, social media can be good or bad, and I think this is an opportunity where we can use it to do some good. If you follow me on Twitter at Tisha, Tisha Rowe MD, go check out my tweet to Greg Abbott, retweet it if you don't feel like coming up with an original tweet. Check out Sean King. You can sign the petition if you too agree after evaluating the evidence that he is innocent. And just let's try to save this man's life. I think that from what I've read, looks like there's some other things that need to be investigated. All right, that's it for me. Hope you all have an amazing day. 100-mile challenge. I ran this morning. I need to run this afternoon to catch up for this weekend. I had Chase this weekend, no babysitter, and his bike is in storage, so we weren't able to go to the trail, but I'm going to make up for those miles this week. So if you are joining me in the 100-mile challenge, check out my Facebook page. There's a post there that was posted on November 1st where you can post your miles by day. So each day you go back to that post and post how many miles you ran for that day. All right, guys, see you soon. Thanks for listening and thanks for following.